DMH Newslink, your trusted source for the latest in healthcare news.
DMH Newslink.
Hi, I'm Michaela Hunt with DMH Newslink, and we're joined by Dr. Dold today to talk a little bit more about those newer stroke guidelines. Dr. Dold, thanks so much for being with us.
Thank you very much for having me.
So tell me about these changes in the guidelines. What are they?
Well, previously, the guidelines have been in place since about 2006. Here at DMH, we have a stroke team that is constantly in evolution and keeping up to date with those guidelines. We have the imaging techniques to diagnose stroke appropriately. Previously, with the intravenous clot-busting drugs to try and restore circulation to the brain, the window was 4 hours from the time the symptoms started. This year, in 2018, the window to treat stroke has expanded up to 24 hours or more. There's two types of stroke. One is an ischemic stroke where a blood vessel plugs up. Second is a hemorrhagic stroke where a blood vessel bursts and bleeds. It's important to get a CT scan to distinguish between those, and then also imaging to help predict which patients have a large vessel that might be blocked. Those patients are a candidate for an intervention, meaning we could get a catheter up into that area and open that blood vessel up to restore circulation and potentially stop and reverse that stroke.
Some amazing advancements when it comes to the timeline. It sounds like an early intervention is so important, yes?
Yes, with time is brain. Every minute that passes by, we lose more brain cells that potentially are salvageable. So it's important for individuals to recognize when they're having a stroke. For example, if they have a sudden onset of balance problems, loss of vision in one eye, a droopy face, weak arm, speech problems, it's time to call 911 and get to DMH or a center that can treat your stroke.
And I think about that be fast to think about the symptoms.
It's easy to remember that, and you can get a magnet to put it on the fridge so everyone in the family can recognize that.
Now these guidelines, actually some people at one point, there was a buzz about them being redacted, some things taken out. Is that a problem for patients? Well, how should we understand that?
No, recognize that these guidelines change every year. Word gets out about the changes very quickly. Some areas are subject to some debate, but the ultimate goal is to diagnose and treat a stroke accurately and quickly.
Dr. Dold, thank you so much for your perspective.
Thank you for having me.
And for more information, just go to dmhcares.com/news.